We talk about delays. What has been the long delay now that mandates are being lifted? What's the bottleneck at hospitals right now? What are doctors experiencing?
I think we're seeing so much pressure across the system. We've seen increased patient volumes because there's now lots of viruses circulating, not just COVID, and that's driving people to hospital, and that's particularly what CHEO's been experiencing. We're also seeing a lot of staff off sick still with COVID as it continues to circulate in large numbers, and we're seeing huge backlogs of patients that are presenting to care that have medical concerns that have been neglected during the pandemic, presenting with more advanced disease, which need more resources. And on top of that, the primary care crisis is worsening with people leaving family medicine and many people having no choice but to seek care in hospitals. So all those things are adding up to huge pressures on our emergency departments. They're understaffed because of illness, and there doesn't really appear to be any near solutions in the near term, which is really worrisome.
But when I hear 700,000 delays, 600,000 fewer surgeries performed in the first 22 months of the pandemic compared to 2019, just last thing to you, Dr. Smart, on this round, is there any way to catch up, or how long will these delays last?
Well, I think what we're seeing is people are projecting, years to catch up this backlog because, of course, patients are still coming. So this queue is getting longer, not shorter. It's going to take significant resources to, of course, be able to address these two things simultaneously and make sure that we're getting through that backlog of patients. What really might surprise people to know is the people waiting the longest right now in Ontario are actually children. They have the longest waits for everything, whether it's medical imaging, surgeries, mental health, wait times in emergency departments. They're the group of patients right now that are affected the most.
Yeah, so Dr. Smart, are you getting pressure to say, look, if the public system can't handle it, we don't have the money, it's time to talk about that third rail, private care, like you can get a private MRI in Quebec. Is that actually coming?
Well, I don't think we know what is coming, but what's clearly coming is the collapse of the current healthcare system that we have and that Canadians want. I mean, Canadians value publicly funded, universally available healthcare, but there's also a responsibility to government to make sure that it's being delivered. And right now, what we have is hundreds of thousands of Canadians suffering in very real ways, in pain, unable to get services, in waiting lines, in emergency departments, unable to get a family doctor. The system is collapsing around us, and I think what we're not seeing is the political will to take that seriously and actually take some action and move beyond just talking about it.